Today's video is about men family planning. Yes, family planning matters for men. So if you want to know everything about this, kindly watch today's video to the end. Hi families, welcome back to my YouTube channel. Today's video is about the male sterilization or vasectomy. So kindly watch today's video to the end to know everything about it before you go in for it. I'm Janet Obusuwa, your community health nurse papa, and this channel is about health education for kids and adults. Thanks so much for stopping by, and thanks to all my subscribers. Kindly subscribe to my channel if you are new here, and then like, share, comment down below at the comment section. On my previous video, I talked about the female sterilization, so we'll leave the link down below at the description box so you can go check it out. So let's go straight into today's video, which is about the male sterilization. When we talk about male sterilization or vasectomy, that is also a permanent contraceptive method for men. Yes, for our men, at least they also have one. So men who do not want any more children can go in for this male sterilization or this vasectomy, and it involves a simple and then quick surgical procedure, and it is much simpler than the female sterilization. So let's see its mechanism of action. The vast difference, that's the tube that carries the sperms into the seminal vesicle, is blocked to prevent the passage of sperm into the seminal fluid. Any man who ejaculates semen, which is sperm-free, will no longer make a woman pregnant. Yes. So once it is done, you cannot get any woman pregnant. Alright, so let's see the procedure for this vasectomy. One or two small incisions are made in the scrotum, and then the vas deferens, that's the tube that carries sperms into the seminal vesicle, is located, tied, and then cut. The incision is then stitched, and in some cases heat is applied to the end of the vas deferens. So let's see the preoperative procedure for this vasectomy before you go in for this operation, before you go in for this procedure. So client is being asked not to eat or drink for 8 hours before the procedure. Then we also inform the client to the procedure takes about 10 minutes. So you see the female one takes like 20 to 30 minutes, but for the male 10 minutes, then you are good to go. And then he should come to the facility with someone to help him go home after the procedure, and then assist him to sign a consent form written. And then after the operation, let's say the post-operative instructions for this vasectomy or male sterilization. So you are to rest for 2 days. Then you put an ice pack on the scrotum for at least 4 hours to do away with the swelling. You are to wear underwear or pants for 2 days to support the scrotum, and then avoid heavy work or vigorous exercise or work for 1 week. Then you keep the incision clean and return within 5 to 7 days to remove the stitches, and then resume sexual intercourse when you feel comfortable, but must use a backup method like a condom for 3 months or 20 sexual acts, since it is not sterile immediately. And then should also report with these warning signs like the fever, excessive pain or swelling, and then also bleeding or pus from the incision sites. Let's look at the advantages of this male sterilization or the vasectomy. It is highly effective, and then fear of unwanted pregnancy is removed. Then it has a lifelong pregnancy protection method, and it does not interfere with sexual intercourse, does not affect a man's ability to have sex. When it is done, you can still perform very well. It won't affect your ability to have sex. Then no long-term risk, and then it is easier to perform by a trained personnel or a trained person, and then it allows men to use his money to give better care for the fewer children or for the already children one is having. Then let's see its disadvantages too. Of course, it has its disadvantages. One, it is not reversible. It is a permanent method, so you really have to think about it very well before you go in for it. And then must be performed by a specially trained doctor or specially trained health personnel. And then pain in the scrotum and then swelling for some few days, then bleeding or infection at the incision site. Then you have to use a backup method for 3 months or the 20 ejaculations after the surgery, and it has no protection to against STIs and expensive at the time of the surgery. An amount of money is required, which is quite expensive. So let's see the medical eligibility for this vasectomy. An individual who does not wish to have any more children can go in for this vasectomy, and then one who is stable marriage or in a relationship can also go in for this vasectomy, and then partners who have no other sexual partner who has no other sexual partner too can also go in for this, and then one who is informed about the procedure and has waited for that 30 days after signing a consent form. Since it is a permanent method, we give you a lot of time to think about it before you go in for this. And then let's see non-eligibility for this vasectomy. I know those that can't have it on. If you have a scrotal skin infection, you can't go in for this. And if you have hernia, you have to repair the hernia for you before you can go in for this vasectomy. Other than that, you can't have it. And if you have any inflammation of the tip of the penis, the sperm ducts, or the testicles too, you can't go in for this vasectomy or this male sterilization. So kindly think about it very well before you go in for this. The vasectomy or male sterilization is one method of family planning for our dear men. So the other method of the family planning for the men is the male condom, and I already have a video on it, so we'll leave the link down below at the description box. So I'd like to end here for today's video. If this video is useful, kindly give it a thumbs up, like, share, comment down below at the comment section. On my next video, we'll talk about the misconceptions about family planning. Okay, so if you are new here, please subscribe for me and hit the notification bell so anytime I upload a video, you'll be the first to get it. Also, like, share, comment down below at the comment section. See you again on my next video. Bye guys, love you.